And welcome back. Our next guest is a Bronx-based therapist, and she's a professor and an author too. And she joins us to speak about how she's empowering women and girls of color, and spotlight her book, Girl, You Cute. I like to say, Girl, You Cute. It's a healing journey for the black and brown girls who's been overlooked and underserved and undervalued. And she's told she's too much.
Yeah.
Girl, you too much. So please give a warm welcome to Dr. Cheryl Clarke. Welcome,
Hi.
welcome, welcome.
Thank you for having me.
It's all right here.
Yeah, it's all right here in this book.
Yeah.
It's my baby.
Girl, You Cute, a therapist's memoir of healing the inner girl and finding her voice.
Yeah.
Talk about that, because a lot of people, there's an outer world, but then there's an inner world,
Yeah.
a subconscious world. And you go in, you try to find who you are. Who am I?
Yeah.
Because people used to grow up looking in the mirror and say, who's this person? Why am I here in this space and time? Who am I? It's in one of those records, too. But, you know, people ask. They want to know why they're here and what's their purpose in life.
Yeah.
Until they find that.
Yeah.
So how did you get started with that?
Yeah, so thank you for asking. First of all, thank you for having me, actually. I am a psychotherapist, and I've been in the Bronx for many years. I'm born and raised in the Bronx, BX in the house, for real. So
you got to go like this.
You got to go to BX in the house, right? Exactly. So what happened is, as of me being a clinician in the South Bronx, I've noticed that so many black and brown families that come in, they say the same exact thing. They say the same exact thing. So, and the thing is that our voice is usually the thing that goes and is taken from us. So usually if there's any shock, trauma, if you're happy, it's the first thing that takes is your voice. So I realized, I said, it's a little different for us because our stories are a little different.
Yeah.
So I decided to do something about it instead of being on the background. I said, well, let me start to do something about how I can be a solution for it.
Yeah. So then you said, you know what? Let me see if I can put the pen to the paper and come up with a book.
Actually, it didn't happen.
It didn't happen right then.
Let me tell you how this book came about. I do every year called the Power of Her Voice Award. So so every year I highlight a woman in the community of color that is doing something big, that's doing something wonderful. And what I did was, this particular time, I had a panel at the end, and they asked, someone stood up, one of my friends stood up, and she says, what would you tell your 12-year-old self? And I tell you, Bob, Dr. Bob, it just came like that. Girl, you cute. I would tell Cheryl.
Girl, you cute.
Girl, you cute.
Yeah.
And there was a little girl in the audience. Her name was Sky. And her mother came up to me afterwards and said, Cheryl, out of everybody that said anything on the panel, she said, Sky gets bullied every day at school.
Oh, okay.
And Sky was there. And she said, your words meant so much to her. I bent down, I said, Sky, you cute. And from there, I said, I need to get this out. I said, this is a movement.
Yeah.
I need to begin to see, because there's so many Skies out there.
There's a lot, yeah.
Yes.
Absolutely.
So that's how it started, and that's how it began. I said, it took me 3 months. It was in print. It was just like that.
And then you wanted to advocate for women and girls of color.
Exactly. So this is exactly what it's going to do. So what this book does is a guide. It's a memoir. It's a love story. But it's also for our allies when they come to therapy. So when they don't look like us, they look for people that can speak the same language. However, get the tools that they need that in their toolbox when they are feeling as though they're in survival mode. And a lot of us are in survival mode. And we're just surviving from day to day.
Yeah.
And therapy is not in our medical standpoint there. We don't go say, oh, you're just crazy. What are you going to see a therapist for? So those are the things that I said, I'm going to start to advocate for us. And it's for you, it's for uncles, it's for fathers, it's for anybody that's taking care of us, to see that their voice matters.
And you heard the military veteran that was in here before you, and she was talking about therapy and all the things that she had to go through, and all the people that she knows need that type of therapy.
Exactly.
Are you dealing with the military world also?
I'm not exactly dealing with the military world, but there's things, traumatic experiences that has happened
Yeah.
that is corresponding with things that people go to PTSD that happens from military. They come back to the family. How do
Yeah.
I now be in a space where I just was shooting and doing all other things that are happening to me? How do I now come back into this world and then survive in the world that I don't know what it looks like?
Well, you know, you can suffer from PTSD right here in,
Exactly.
in our communities too.
Exactly.
And that's why she was trying to, you know, put the difference together. She said, you know what, if I can do the Bronx, I can go there. And that helped her cope
Exactly.
with her being away
Exactly.
in military service.
Exactly. That is how we have normalized some of the things that I talk about.
Yeah.
When I say that we're too much, fix your face, you're strong, you got this. Sometimes you don't have it. And sometimes you need someone to immediately get you to a space to give you the tools to bridge it. So I always say when trauma happens, and this is why I created the voice recovery method.
The voice recovery method.
Yeah, so the voice recovery method is the first V is for value. You have to value your voice. Value that I even have a voice. Validate the voice. How do I validate my voice? Understanding that that my voice does matter. So the voice recovery method bridges a bridge over the trauma, never to forget the trauma. I never tell people to forget their trauma because you
It's like
cannot.
doing bypass surgery.
Yeah.
Yeah.
Yes, I guess yes.
Yes.
Yes. You're clearing it out so you could be able to bypass back
Yeah.
and forth. Exactly.
Yeah.
Exactly.
Yeah.
Exactly.
You know, I have an operating room, so I know about the bypass surgery.
Okay.
On radio.
Oh, okay. Let's get that clear. Did the doctor stand for? Okay.
On
got it.
radio.
On radio. Gotcha.
But
gotcha.
we do talk to a lot of people, and people are seeking a way out of certain things.
Yes.
And you know, I'm not a medical doctor.
Yeah.
But I help people by inspiring and
Yeah.
giving them maybe information
Correct.
that will help them get out, and a voice, and an ear, a person that can listen to, and that's important too, because a lot of people don't have people to talk to, or just have somebody to lend an ear.
Lending an ear. And that's where you get a space where we may not understand that we even need someone and what we need in the moment.
Yeah.
I always say we don't know what we need until we need it. So, and then someone tells you, so the power of your voice allows you to seek, and just like it says on there, the power of your voice, what does that look like? What does the women of voice recovery for women of color looks a little different, because our pain is a little different. Someone asked me, why it's for all women. I said, I got that. I said, however, I said, for this specific one, I wanted to create something for women of color, because our story is a little different. We're always told to be the strongest, and we mask anxiety, we mask depression. Sometimes we go through postpartum depression after having a child, and we just normalize us sitting on the couch, or normalize us not being with it. So I show people how to have self-regulation. I show people how the tools for them to walk through transitions. Someone passes away. I just had a friend pass away. She was always the anchor for the family. She never asked for help. She never asked for support. She never found that voice to say, I need support. She died early.
Because she's busy giving to everybody
Giving
else.
to everyone else. So this slows you up to say, how can I move this area? Even in education, I talk about my story in education. I had dyslexia. I didn't realize I had dyslexia until I was in my 40s.
You thought it was normal, right?
Thought it was normal. So when you look at how you're moving, grew up with an emotionally abusive stepfather. These are things in this stories that I tell to bridge it, so people can understand that this is just not Dr. Cheryl. She has come and arrived. No, these are stories that I've heard in my office time and time again.
Yeah.
How we apologize for even showing up. Oh, I'm sorry. For taking up space.
Yeah. And Dr. Cheryl, do you do it the old-fashioned way? You have a couch You have that famous
I used
couch.
to have a couch. I used to have a couch in my office, but a lot of my clients, which is great, I'm virtual.
Just want to sit there.
Yeah, too. And I'm virtual a lot of times too now. I'm reaching a lot more people
Yeah.
where they couldn't make it to therapy because of their
Right,
time.
right,
Because a lot of us have 3 and 4 jobs to make it. Let's get real. Or children, or just I said, just carve out that little time, 45 minutes for yourself, just to speak. So now what they're doing is the curriculum. What it is, so you can get with 10 young ladies, sit a time that fits for you.
Yeah, that's a
and this
good
is
idea.
what it makes a difference. This is what I'm doing. So now we're taking it to the next step. We did a curriculum, Girl You Cute, and it's going to be in the school system. So I'm excited about the next steps of Girl You Cute and Speaking Your Power now.
So a person takes away what after reading your book? What's the takeaway?
So there's so many. So say it's a mother and daughter reading this. There is a connection here that you can now bridge the
Isn't
gap.
that cute?
Yes, Girl You Cute. You can bridge your gap with your daughter relationship, your mother and daughter relationship. You can actually, as a male, get this and see, how do I now speak to this young lady that I've been guiding? So it's a guide. It's a mental health guide.
Yeah.
It then also gives you the tools in here that if I'm not going to therapy or seeking therapy right now, I can pick this up and it walks you through some actual, it has actual mirror talk. So I use a mirror a lot. This is what the compact, it comes with the compact. I have, they
Look
can
at
carry
that.
around their little bag, they can put their
Look
bag
at
in their
that.
book.
All right.
So it's a movement going on.
You're a marketing
where
expert also.
Exactly. I want
And a
everyone to
therapist.
know. Exactly.
And an author.
And a mom of 6 and a wife. So it's like I have to know. I want people to take away that their identity is what you created. And someone doesn't have to give you the label, or maybe you've been mislabeled or misunderstood. So this book helps you to just ground you and ground people that are now allies to how to treat them when they come in and recover their voice.
So a lot of people don't think that they have a situation or a problem because, and if they do, they don't want to seek help because of the stigma attached to it.
Yes.
What do you tell people who need help and maybe want to reach out? They say, you know what, she made me feel comfortable on TV. I would like to reach out to her and become a part of her sessions.
Yeah. So the first thing is I always validate them for calling me, because a lot of us are not seen. And I make sure that they're seen. I make sure that and see what they can do. So I always offer them, and if I'm not a good fit for them, we always go to the next step and see who it may be a good fit for them. Because that's the right thing, that's the right key. Getting the therapist that's the great fit for you.
And you help them to find their voice.
Find their voice. That's my specific thing. Once I get you to find your voice, I believe you on the roadway of knowing that you matter and that you can show others they matter.
He'll be talking and singing.
Absolutely, absolutely. I love it.
Information, you get the Zoom call, then all that information. Give us some information. Is
Yes.
that all on your website?
Absolutely. Go to
Social media?
speakyourpowernow.com and you can go ahead and visit me there, or you can go to Girl You Cute. And we have what I do for free, what you can go on every Tuesday at 8 a.m. Eastern Standard Time. I go live on a Zoom call. So all you got to do is go to speakyourpowernow.com, sign up to be a part of our power call. Yes, every 8 a.m. every Tuesday morning. You come on there, I'm live. We get a power call. We're just on there for 20 minutes. It's to give you your power boost for the day. And we're doing that every single morning.
And we're going to say it together. Girl, you cute. Ready?
All right.
Ready? 1, 2, 3.
Girl, you cute.
You too cute. Oh, that's the second book. You too cute.
You too cute. No. You just giving out the bombs today. The bombs.
All right, Dr. Cheryl A. Clarke, LMFT, PhD, therapist, professor, author, and founder, Speak Your Power Now. And Girl, You're Cute, author. All right. We'll take a quick break. I've got more. You're so cute. Oh, look at you. We'll be back with more Open next.